Jill says, from my doctor, TSH is fine, so you have no issues. How many people have heard that? And Dr. Maggie, is that accurate?
Okay, if someone tells you, this is the thing is people will say, oh, go get your thyroid tested, do this. Well, when they tell you to do this, all it means is you're going to get a TSH done. And I'm going to ask Kathy and Jason, should they do this? Go get their TSH, get their thyroid labs done and get a TSH. What do you guys think? Let's weigh in.
Can I say, hell no? Can I say that?
No, and hell no.
Because TSH isn't even actually a measurement of a thyroid hormone. It's the thyroid stimulating hormone, and it doesn't mean a whole lot.
It's a brain hormone, people. It's not actually a direct measurement of your thyroid, any of your thyroid hormones. It's a brain hormone.
I agree. You know, like I said, a couple decades under my belt with this, I can't tell how many TSHs I've looked at that were completely normal. But when we dive in and look a little bit deeper with the thyroid, and actually look at the real thyroid hormones, the inactive, the active, I mean, we find people low all the time with perfectly normal TSH. And it frustrates me that our colleagues out there say these incredibly, misinformed things that if your TSH is okay, you're okay. I mean, like Jill said in the comments, I mean, people hear this all the time and it's just ridiculous. I mean, it's ridiculous. Anyway, that's my thoughts.
Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. Well, Loretta's jumping in right now, and she's one of our alumni, and she relates a very similar story. She says, same here. TSH was checked, and I was told everything is normal. Everything, you mean one lab test, by the way. Well, sure, I guess everything, that's one thing. Even when I had the full thyroid panel done, I was told everything was normal. And how many of you guys were told you had a full thyroid panel? I'm curious. Only to find out that it was just the TSH, or it might be TSH with one other lab, like a free T4 or something. And you were told that was the full panel. How many have been told that lie? That's a lie you shouldn't accept. That's a don't do that, which is be told that you had a full panel when you had just 1 or 2 labs on the thyroid, one of which is a TSH. That's not even a thyroid hormone. It's a brain hormone, right?
You would ask for feedback from the alumni, and it's not just Loretta that's saying that, what's happened since going through the program. Rachel chiming in again with some more information saying her thyroid numbers now, she knows, look amazing. First time seeing this after graduating the program. Mm-hmm. And also she can tell because she feels better. Metabolism, energy are back to where she was in high school.
I can't believe it. I love it. I love it. Yeah. So it's really important. Do this when people say, go get your thyroid labs checked. Don't be bamboozled into thinking it's just a TSH or just a TSH in one other lab.
Yeah. And the other thing with the TSH, if you go to different labs or I know here in Canada, in different provinces, even the TSH number will vary as to what they consider normal. So here in Ontario, you can have a TSH up to 5 before they'll consider putting you on medication. Whereas in other provinces and other states, if it's above 2, they would consider putting you on medication. So even that discrepancy makes me a little crazy.
Well, there's actually a lot of controversy even on the TSH. And so to talk about just training from medical doctors, I was trained top medical school in the country. And I practiced as a family practitioner for the first 10 years of my practice. And I also trained other family physicians and manage other family physicians. And we are trained that TSH is the only lab that you need to do to evaluate a thyroid. So no disrespect to doctors, but this is how we're actually trained. And when I look back at how I treated patients myself, that's probably one of my biggest shame is that to accept what we're just being taught. And one of the things that I was taught in med school by a very astute teacher was everything that you're learning here today, in 5 to 10 years, you're going to be practicing the opposite and it won't be true anymore.
Wow.
What else I wanted to throw in here too is that in the comments, I saw Linda mention that doctors really don't understand the thyroid. And that's the reality. I mean, you just underscored that. We're not really trained beyond TSH. And that's part of the problem because who do you go to? I mean, you have your doctor. I'll even say endocrinologists that, I mean, these specialists, you know, people aren't trained beyond TSH. And if it's out of queue, look at the free T4. And if that's okay, we're good, you know, and it's just not a lot of thought. And there's just so much more to it than that.
Well, I mean, I had an interesting conversation with Julie today, and we were talking about how she had been seeing multiple functional medicine doctors, even a hormone, she put in air quotes, hormone expert, and two to three endocrinologists all told her that she had full thyroid panels, her hormones were fine. And we got talking to what are really the root causes underlying her symptoms, right? And she said, well, what is the root cause? What is really the root cause? And something to really think about, okay? The number one problem with low thyroid, what is the number one major cause of low thyroid? Do you guys know? Type it in chat. What do you guys think is the number one cause of low thyroid and high thyroid? We're not missing out on all you high thyroid people, just so you know.
I think the question is really interesting too, and I'm looking forward to the answers. But here's the thing: if you can answer this question, what's the number one cause of hypothyroidism, hyperthyroidism? If you can answer this, I promise you, you know more than 95% of the practicing doctors that are out there.
I wasn't taught this in medical school or in my first 10 years of medical practice. Okay.
Right?
So we're getting some guesses in. One person says digestion. Another person, Emma Infodump, says autoimmune attack.
Chef's kiss Emma info dump. I love that. I love that. So what I think is important to understand is that below the thyroid labs that we're talking about, yes, there are comprehensive thyroid labs you can do. Don't just settle for one or two, number one. But number two is the patterns of these thyroid labs tell a story. And the number one story that it tells me or Kathy or Dr. J is that there's an underlying autoimmune attack that no one's dealing with, right? Where the rule of the game is you're supposed to hit a target, but the target's moving the whole time. If you don't understand that piece, then all you're going to be doing is chasing these symptoms in the moving target, always behind, right? Thinking, I just need a thyroid dose adjustment. I just need to do this. I always need to do that. But it's already passed. It's already on to the next thing. It's a process. It's actively ongoing. So I love the fact that it's not just about thyroid labs. It's what is the story? What is the pattern that these thyroid labs are actually teaching you and telling you about? What is it about the underlying root cause that's causing that autoimmune attack to go whack like crazy, right? How do we stop that? So then the target stops being a moving target. How about that?
A lot of people chiming in with their symptoms and being told, despite their symptoms, their thyroid is fine. You know, they have all over pain, severe night sweats, red face and neck, dizziness, heart palpitations. We have people saying depression and anxiety. People are getting it's all across the board what the symptoms are. And yet your thyroid's fine. You're fine.
But the person that talked about, like, look at Julie talking about nodules, insomnia, brain fog, heat intolerance, hair loss, and much more. Julie, every single one of those symptoms is totally connected. And there's a story that's telling, I already see the story and I already know all the plot twists in the story. I saw it, 10 years back. But the thing is, how do we stop that? How do we prevent that? Right? Yeah. What do you do about that right now? How do you intervene in this pattern? Does it have to be a story where the end is already the pathway and the end is already predetermined? Or are you going to be interrupter, the protagonist, the hero in your own story here, right?
Yes. So the do this, not that, just to summarize, is don't rely solely on TSH.
Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.